Thursday, February 20th, 2003, WCBD-TV Channel 2, Charleston, South Carolina, ran a story on their evening newscast about a marvelous lady who had gone through the agony of breast cancer and the after effects of what to do, if anything, about having reconstructive breast surgery. Her search led her to discover a new reconstructive technique called a DIEP flap, which led her to East Cooper Plastic Surgery Associates Dr. James Craigie and Dr. Richard Klein, who specialize in this operation. This story was broken down into 4 segments. The first segment ran between 5 and 5:30, and the main segment ran between 6 and 6:30, with 2 teaser segments between 5:30 and 6.
In other news tonight, 1 out of every 8 women will be diagnosed with breast cancer in her lifetime. Survivors who undergo mastectomy or breast removal face some serious decisions about what to do next. Tonight, in a special report, we explore a new option for them. Recently, Lowcountry resident Catherine Wellborn had a new DIEP flap procedure. It's a new, less invasive form of breast reconstruction. She invited our Count on 2 cameras into the OR to document that surgery.
And Catherine is going to join us now to tell us more about her experience. Thanks for joining us.
Thank you so much.
Thank you for having me.
Well, you researched this topic thoroughly. You read literature, you talked to other patients. What stands out about what you learned?
Well, gosh, there's so many things that do stand out, but one of the things that it was so painful, the reconstruction was so painful because they cut muscle. And anytime you cut muscle in your body, you're taking muscle where it's needed, putting it someplace else. Well, it's just not good. So I didn't want to do that. I mean, it's a difficult decision. A lot of women decide not to have any kind of reconstruction for this very reason. They say, I just can't do that.
And now with this new procedure that you had, it was less invasive, and was that the main reason that you chose it? What was the main reason you went with this procedure?
The main reason I went with this procedure is because it's so much less invasive. It does not cut muscle. From my body's viewpoint, it's like healing cuts. It's extremely complex from the surgeon's viewpoint, but you know, from mine, I'm just healing.
That's their problem.
That's their problem. Here I am, 6 weeks after surgery. I ride my bike.
Feeling much better. And
Fantastic.
You've also become an advocate for other women who are going through this, helping them out. What would you like most for them to know?
I think that I would like for them to know, call for help. When you go to the surgeon's office and he said, you have breast cancer, call for help. Ask somebody that's been there. Reach to Recovery Volunteers at the American Cancer Society is a great resource.
Okay. And for women and others who would like to hear more about your story, we will have that breast reconstruction, a new option, tonight on News 2 at 6 o'clock. Thank you again for joining us.
Thank you.
Thanks for joining us.
Straight ahead on News 2, a Lowcountry doctor performs a breakthrough surgery to help a cancer patient rebuild her body and her life. It's a story you don't want to miss, coming up in the Count on 2 Medical Report.
Count on 2 medical reporter Erica Bryant Fields.
A specialized team of plastic surgeons is offering a new option to breast cancer survivors. At East Cooper Plastic Surgery, a medical group which includes 2 microsurgeons is offering a unique type of breast reconstruction. It's called DIEP flap. A woman's chest is rebuilt using excess skin, fatty tissue, and blood vessels from her stomach.
This technique preserves the muscle and actually removes the very small blood vessels from within the muscle and leaves it intact. The muscle, the belly wall, is very important for daily activities, work, lifting, those type of things.
Now, a local woman allows Count on 2 cameras to follow along as she goes through this procedure. You can see her story in a special health series tonight at 6 o'clock. And Lowcountry physicians were trained in this new option by Dr. Robert Allen in New Orleans.
1 out of 8 women will be diagnosed with breast cancer at some point in their lifetime.
those who undergo mastectomy or breast removal often consider breast reconstruction. Well, Count On 2's medical reporter Erica Bryant-Fields has this special report on a woman who chose a new option. Erica.
Catherine Wellborn is a breast cancer survivor who became a breast reconstruction researcher. She chose to share what she learned to empower other women. We must warn you, some of this video is graphic.
Come on, you ready to go for your bicycle ride?
Catherine Wellborn is on a roll. Just weeks after major surgery, she makes recovery look easy.
I feel really, really good.
That's how she's handled the past year. A year that began with suspicious symptoms and then a blunt diagnosis.
Sat right in front of me and said, "You've got breast cancer." I have no doubt.
Instead of fear, she faced it head on with optimism and strength.
It was a relief because at least I knew what we were fighting. You know, and you can survive breast cancer.
She had a mastectomy, complete removal of her right breast, and chose not only to survive, but thrive.
People would say, "Oh, don't you hate to look in the mirror at the scar?" And I said, "I don't look in the mirror at the scar, I look in the mirror at me. A breast does not make me who I am." And I have a wonderful husband, and it didn't seem to matter to him.
She searched for the next step. Some surgical options seemed too invasive.
They take muscle from your stomach and they tunnel up into the, oh my gosh. Or they take the muscle from your shoulder and move it around, and you have to have an expander, which is a foreign object.
But when she still couldn't get clothes to fit properly wearing a prosthesis, she learned about a specialized team of plastic surgeons performing an innovative technique called DIEP flap. It could restore the contour of her chest using her own tissue and have the effect of a tummy tuck at the same time.
I had so much trouble hearing about this particular procedure. And if just one woman hears about it and has the procedure, if just one woman learns about it, that's why I'm doing it.
She decided to share the experience, allowing Count On 2 cameras into the operating room to document the surgery.
The main difference between this operation and, say, other non-muscle sparing operations is that the muscle stays in its natural place and the blood vessel is separated from it.
The DIEP flap procedure can take anywhere from 4 to 10 hours.
The DIEP is a deep inferior epigastric artery, and the P stands for perforator because that's the type of flap it is.
It takes 2 microsurgeons to get the job done. One works on the stomach preparing the flap. He removes excess skin, fatty tissue, and the amazing part, he also takes tiny blood vessels from the muscle there, but leaves the muscle itself intact. The other microsurgeon works on the chest, preparing the transplant site to accept the new addition. Then the 2 surgeons work together to sew the flap into blood vessels on the chest, giving the new breast a blood supply. Making sure those vessels stay connected is critical.
The highest risk period is in the first 12 hours.
So during that time, it's standard for patients to be monitored in ICU.
The very small blood vessels are sewn together under the microscope, and from time to time they can shut down.
In Catherine's case, that happened. Surgeons started over. On the second attempt, success. On day 3, she headed home, in more pain than she expected, but still pleased with her choice.
I feel pretty good. Now, I can't run any races, but, you know, it's pretty amazing that Tuesday I felt like warmed over death, and, you know, every day I felt better.
Fast forward 6 weeks, and she's back to her previous routine. Because muscle wasn't moved or cut, that means fewer complications, better outlook long term, and a positive story for other breast cancer survivors.
One woman, if I could help just one woman, and I've already talked to 2 women, so I'm like, that might go, and it exceeded it.
She sure did. Now, to complete the process, in April, she'll have another surgery to reconstruct the nipple itself, and the final step, tattooing its color, will follow. And Trey and Nina, again, she says she will tell her story to any woman, any individual who will listen.
And we had her in the studio today. She is full of energy.
Full of energy.
Thank you,
Thanks,
Erica. What a brave lady.
She is a great lady.
Good story like that. Well, you have